civil fines or penalties?
We have no civil fines on individuals at this time.
Senator, do you want the president to use the Defense Production Act to ramp up production of medical supplies?
Look, if I had if you can make these products. I'm trying to make these products. If you are in this line of work, we need masks. If you're making clothing, figure out if you can make masks. I'll fund it. So I'm doing everything I can to increase the production. That's besides having people all over the globe trying to buy product, right? We talked about Empire State Development people literally running around China trying to buy product. So if I had it, I would use it.
You've mentioned stockpiles. There's 3 stockpiles around the state of masks, gloves, things like that. Have those been dipped into, or are you shipping those to hospitals around the state?
We have dipped into those, and we are providing those to the hospitals that are across the state, and we're also working to resupply them.
Can you give us a sense of how many you've shipped across the state?
I'd have to look to give you an exact number.
The federal government extended tax filing deadlines sometime in the summer. Is the same? What's New York's new deadline?
The deadline is the federal deadline, and Robert Mujica, the man of many facial communications, will explain it.
Because of electronic filing, we're tied to the federal deadline, so our deadline will also then move with the federal deadline to the end of July. On the sales tax deadline, we're going to forgive interest and penalties related to the sales tax.
So are you pushing the deadline back?
The deadline stays the same, but there's no interest or penalties for those who can't pay or give their
This is the deadline they will be charged.
Correct.
Or penalty.
Or penalty. Interest or
John.
penalties.
Penalty is worse than the interest.
At this point, can inmates and detainees use hand sanitizer in those few cases in Rikers where
Sure.
you can?
Sure. We're making hand sanitizer. By the way, I know a lot of people got annoyed that we use Corecraft, which is the prison company, to make hand sanitizer. The Corecraft company was already making chemicals, detergents, automobile lubricants, hand soap. So it was in their line of work. But the hand sanitizer is distributed to prisons, public transportation facilities, state government, local governments, etc. And we're increasing the production of hand sanitizer through Corecraft because we need it. The shortage has only gotten worse.
What's the state's new death count as of this morning?
Do you know that? 35 people.
New York City?
I don't know. I can get you the breakup. Do you know off the top of your head how many in New York City?
What's up there?
The ages and
Was that up there?
underlying health conditions?
I'm sorry, can you say that yourself?
Did we have a range of ages for those who have died and whether or not they all have underlying health
It's
conditions?
primarily senior citizens.
We now know that Albany Medical Center and St. Peter's Hospital have stopped performing tests. We understand that Ellis Hospital has run out of them. People in the capital region, is there a place they can go to get tested?
Doctor?
Sorry, I was looking at the slide. I'm sorry.
It's okay. We've heard that Albany Medical Center and St. Peter's Hospital have stopped performing tests, and Ellis Hospital has apparently run out of them. So people in the capital region who might need to be tested, where might they go?
At the Albany Medical Center, they're still testing. We can look at other places if we feel that there aren't enough places to provide the test for people.
And actually, we have worked that out. We're working with BioReference, who's our lab that came online earlier this week, and they're going to be processing tests for Albany now.
So some other states, and obviously Albany had this announcement that the only people who are going to get tested are quote-unquote frontline, doctors, nurses, first responders, etc. And that if you're sick, you think you might have coronavirus, the advice is going to be stay home, don't go out, get yourself well. So are you still doing community testing statewide? And what's the thinking about if or when we need to shift that protocol?
So what we are doing is, as I mentioned originally, is to work with your health professional about that. If you need the test and it's clinically relevant based on their assessment, we will get the test done for you. And we have sites all across the state, and you can see by the numbers of how many cases we have tested.
Yeah, Jimmy, we're testing more than anyone. It was never just healthcare professionals, right? It's all these drive-thrus, et cetera. They're just testing people, but you have a protocol that you have to have a fever or have a symptom or have been in contact with a positive person. So it can't just be, I want to test because I'm a lot nervous. But that's for everyone, that protocol.
Just to drill down on this for a second. So for a New Yorker at this point, they can go buy groceries as of Sunday, they can go walk their dog, they can go get medicine, but beyond those sorts of activities, basically you're telling people to stay home.
Stay home. Stay home. Physical health, mental health. Yeah, you need to get out to take a walk and get some fresh air. Yes, there's a practicality to this. You can't say to someone, you must be locked in your apartment 24 hours a day for the foreseeable future, by the way. Look at what you're saying to people. This could be going on for months. Stay in your apartment for 2, 3, 4 months. That's frightening, Excuse me. Okay. Thank you. That was very, very nice of you, John. No, I'm not coming back. There was no provision. I hadn't heard that, but I'll look at it, and I'm sure we can find internet ways. We must have, do we know?
It's been overrun to the point of near collapse, but we've been working every day to continue to restore it and build it back up. There's obviously mass volume right now, but we are working on that.
Mr. Campbell?
You've spoken a lot about the number of hospitals you need and increasing capacity, but how do you build mobility in the system? It's like 1,000 hospital beds in Long Island doesn't do any good if you have like a second site in Buffalo. So how do you build mobility in the system?
Good question. The number one challenge, we need 30,000 ventilators. Everything is second to that. After that, we need beds, we need staff. Mobility, in truth, John, we'll move people. We're looking at these temporary facilities. Remember how this disease progresses. You don't come in and need an ICU unit in 15 minutes. You come in with fever, respiratory symptoms, etc. If we didn't have a hospital, if you come in and you live in Suffolk and we don't have a hospital bed in Suffolk and the hospital bed is in Queens, then we're going to put you in Queens. You're right, it's not convenient, but that's the least of our worries right now, frankly. So wherever we have beds and equipment, that's where we would put people. I'm even working on coordinating between upstate and downstate. We have lower numbers in upstate. So we're coordinating the downstate need with upstate hospital beds. So it could be a person comes in and from New York City, but we have a hospital bed in Albany. And if that's what it gets to, that's what it gets to. If we have a hospital bed with a ventilator anywhere in the state, I would be happy. I'd be happy. If the only thing we were dealing with was complaints that you came in Suffolk and you had to go to Queens, I would take that in a heartbeat.
You've also spoken about needing more medical personnel and getting personnel there. Is there anything that non-medical New Yorkers can do to help out? Are there volunteer opportunities, anything like that?
Well, there is a medical reserve corps that the state and the city have, and they've been activated to help out as well.
There's somebody watching at home who wants to pitch in, wants to help out somehow. Is there anything they can do other than just following the rules that you set out?
That's a good question. Right now, no, but maybe in the future. But right now, just don't get yourself sick, and don't get anyone else sick, right? Don't get yourself sick, and don't get anyone else sick by your actions.
Other localities and states are running short of those swabs needed to do that test. How is New York doing in terms of having those kits available? Are we running low? Do we have enough of them?
Look, we're doing more tests than anyone. Knock 4 million.
Essential services, so restaurants do count as essential. What about food delivery services?
Food delivery counts.
Laundry services?
I don't know. We're working through the list of essential services now. Essential services are, look, society has to function. You have to be able to go to the ATM and take out money, and who's ever on the other side of that ATM, which I don't know, has to be there to make sure you get money. So it's just going through those services that need to function, but not like luxury services. You know, I want to get a massage. That's not an essential service.
Verizon or Apple, right now?
That's an essential service. We've also asked the internet service providers to increase data capacity and to do it at no charge. And we're working through that. In other words, now you have all these people working from home. They all had data usage plans. They might exceed their data usage plan, or you may overwhelm that home service capacity. So it is essential that they work on that. And as a matter of fact, I've asked them to increase the data available regardless of your plan and not charge customers for that.
So for private businesses, say like Best Buy, for example, has like a geek squad. Would that be deemed essential?
The Geek Squad?
People need assistance with their technology.
The Geek Squad. I'm going to go back and check. You got me on that
We'll
one.
have the full enumerated list out this afternoon.
What about, what's your latest thinking on the economy, the state budget? If you're kind of getting less revenue in, are we, as a state, going to get into a cash crunch at some point?
Yes.
So when does that happen?
Well, look, the federal government just moved the filing deadline for taxes until like June, July. We normally had tax payments in April. Now, when you move the filing deadline, it means the state, you won't pay your state taxes until June, July, which means we get no money between April and June, July. That could be $7-8 billion to the state of New York in terms of cash flow. The only way I sleep at night on that one is, look, it's not just this state, it's every state. And this is going to be federal action because the economy is devastating for every state and also for individuals. It's every individual. For the guy who's home today saying, how am I going to pay the rent? First of all, moratorium, you can't be evicted for 3 months anyway. But how am I going to pay the bills? I'm laid off. The unemployment insurance doesn't cover it. Everybody is in that situation. Everybody. And it's going to have to be a situation that this country addresses and this nation addresses, and the state addresses, and we will. But today, one crisis at a time. Deal with what is in front of you. And let's save as many lives as possible. And that's what these policies do. If people want to say to me, Jimmy, 3 months down the road, you know what? You shouldn't have closed all businesses. You added to the economic damage. I plead guilty. I believe these policies will save lives. And I'm not willing to put a price on a human life.
Any questions? Is the state going to halt paying out tax refunds or paying out other things that you were normally scheduled to pay out? And do you have a message to New Yorkers, particularly employed New Yorkers, about, whether they should be paying their taxes at a certain time? Or do you have any appeal to them?
We're going to follow the federal guidelines. We have economic pressure, but they have far more economic pressures than we do. Anyone who's trying to get through this in their daily lives, I don't want to add to their pressure. We'll deal with what we have to deal with. One other point, there was a person in our press office who was exhibiting signs of coronavirus. They're going to be tested, but we, as a precaution, quarantined employees of the press office in the meantime. I'm going to go to work. Thank you very much.